Welcome, everybody, to the Wellness Crusaders show. I'm Patty Reese, and I'm here with Lori Gagan and Jessica Endicott. Happy to have you here today, and we're just going to share our mission with you. Our mission is to educate and empower you to make informed choices for your health, the health of our children, our communities, and our earth. We are committed to fostering a world where the balance between human health and environmental stewardship is respected and nurtured. Join us in this holistic and transformative journey as we work together to create a healthier, more harmonious world for all. Please join the crusade. Lori?
I always love our mission statement.
I do
And before
too.
we get started, just a few disclaimers. That the listener understands that the role of a health coach is not to prescribe or assess micro or macronutrients, to provide healthcare, medical, or nutrition therapy services, or to diagnose, treat, or cure any disease, condition, or other physical or mental ailment of the human body. Rather, the coach is a mentor and guide who has been trained and certified in holistic health coaching to help clients positive, sustainable lifestyle changes. The listener understands that we are not acting in the capacity of a doctor, a licensed dietitian, a licensed nutritionist, psychologist, or any other licensed or registered professional, and that any advice given by the coach is not meant to take the place or the advice of these professionals. If the listener is under the care of healthcare professional or currently using any type of prescription medication, the client should always discuss any dietary changes or potential dietary supplement use with his or her doctor and should never discontinue any prescription medications without first consulting his or her doctor. The listener understands that the information mentioned in our talks should not be seen as medical or nursing advice and is not meant to take the place of seeing a licensed healthcare professional. So welcome, everyone.
Thank you, Lori. Thank you, and Patty. Thank you both for reading those important statements. So today we are talking about ketamine and the risks and the benefits of it. So we're going to weigh both sides of it. We want to inform our listeners about this because it is an experimental medicine that is being more widely sought in more and more clinics. So Lori's making quite a bit of noise with her little papers there.
Sorry about that.
She's organizing and preparing our talk. But this prompted a discussion because I went to look at this treatment center, or I actually went to look at this brand new wellness center that's being built. And they are going to be using ketamine. And when I started asking them the precautions that they're taking and the psychiatrist, how they're going to be administering this, it wasn't okay. It wasn't okay. And I felt that they weren't doing it with a lot of integrity. I felt like they were using money for it. And this is something that really needs to be discussed and brought to our attention because it literally is our lives and the lives of our loved ones and our friends here that are at risk. And there are benefits to it. There are great benefits to it, but there are also really detrimental risks associated with it, including death and including schizophrenia. And so it's something that we wanted to talk about today. And we are professionals in this area because we do work with mental health and we do work with addiction. We work with the brain. We work with the neurochemistry of the brain. This is something that all three of us have been trained in depth on. And Lori's also trained to read brain spec images. So we have a lot of education between the three of us to be able to speak intelligently on this matter. So let's jump in and talk about ketamine and what it is. We've heard the term ketamine a lot, but have you also heard the term Special K? We've heard about PCP, and PCP is similar, very similar to ketamine. It's used in surgeries for sedation. It's an anesthesia. It creates a disassociated anesthetic hallucinogenic effect. And so what this disassociation means is you are detached from your body. So you become detached. It's almost as if you're watching from a distance what's happening to your body, or like you're floating from your body. And this can even happen in trauma. So there's a lot of clients that I've seen that go into this disassociation when they're experiencing a trigger that reactivates that trauma response within them. And the ketamine, it is produced widely. It's produced in Mexico, and then it's brought to the United States. Rarely is it being tested for harmful elements. So we don't know what it's laced with, right? It's so Special K, the date rape drug, ketamine, it's a horse tranquilizer, and it is something that is being abused and used recreationally as well. There's a lot of evidence and a lot of research that they are doing surrounding ketamine. However, it is still experimental. It's still experimental, and it is not regulated right now. So because it's not regulated, there's clinics that are popping up left and right all over the place. There's people that are administering this medicine that don't really understand the depths of it and the precautions that need to be taken to secure safety. There's also integration after using the medication that isn't happening. And so we are going to educate you today on both sides of it so that you can make an informed decision on if this is going to be a treatment that is beneficial for you or your loved one. So they're using, yeah, go ahead, Lori.
So I just wanted to kind of chime in on, like, I know you went and you interviewed, and I also did too. I think the part that's hard is that most of the clinics don't have a medical doctor or even a nurse practitioner like on site. So what happens when they're doing intravenous ketamine and someone has a bad reaction or a bad trip, because basically it's a psychedelic, most of the clinics that I spoke with have the drug, naloxone. They're ready to help in case somebody does have a bad trip. And that's how I look at like what it's doing, because it's really changing your brain chemistry and it's tripping them out.
Yeah, absolutely. And so they're using naloxone, and naloxone is taking them out of an overdose or out of those side effects that are caused by ketamine. And the reason for it is because ketamine also binds to the opiate receptors in the brain. And so it is an opiate. It is working on the opiates, which is what we know heroin works with. We know the Oxycontin, the Percocets, Loratab, all of these bind to these receptors. And so this is to really be cautious of this. And what are you going to say, Patty?
I was just going to say, in the GABA receptors, I mean, its main function is to link into the GABA receptors for relaxation. I mean, it's a tranquilizer.
Right. Yep. Right. And so, and I think that it's also important to note that we as Americans, or we as society, or we as people want that quick fix. And there's not any quick fixes out there. So be cautious of these things that are saying they're quick fixes that are going to be the cure-all, end-all.
Right.
Well, there's a lot of marketing misnomer. And because a lot of these pop-up clinics are really profits over people, they're not going to give you full disclosure on that. I'm always concerned about what happens when people leave, you know. I mean, the age group is 11 and up, but what happens if a a single mom who's taking her 11 or 12-year-old, who may have some signs of anxiety, takes that kid home, and it is a kid. I mean, they're not even adult. And then all of a sudden has a bad reaction or a bad withdrawal symptom.
Yeah.
I just want to interject here too. When I first heard about ketamine being used for humans, I was like, wait, it's a tranquilizer for horses. Like it just didn't make sense to me. And now look we have clinics popping up all over. So I think there's definitely got to be some more information. And as I mentioned to both of you before, this is a business, right? The psychedelic world is a business too. Yes, there might be some benefits, but there's a lot of risks, and it's a money-making business. So if there wasn't money involved here, who knows if there would even be any clinics. I'm just putting that out there.
And Patty, because I asked on pricing at some of the clinics that I interviewed, 12 sessions, and they're going to give you one like boost 6 months a year down the line, $3,600. That's a lot of money for a trial drug.
Yeah.
When we have amino acids that actually, we'll talk about that later, but that, are the key.
Yeah. Yeah. Well, and so a lot of people are looking at this because their SSRIs can take weeks to work. Right? It takes weeks for an SSRI to kick in, and the SSRIs, Wellbutrin, Zoloft, Lexapro, and people are taking, and Celexa is another one, Cymbalta. So it takes like 4 to 6 weeks before that kicks in and people are feeling relief. Now, when there's that extreme depression that's happening, you're desperate. And that desperation is very worrisome to just jump into treatments that say that they're going to treat that. And I get it. And I understand that these lives, you're seriously thinking, okay, I'm going to end my life. And there's this desperation behind wanting to get that fix and wanting to get rid of the depression. But really, there has to be discernment happening. And so we want to help you have that discernment when it comes to your care, your mental health treatment. So this clinic that is going to be opening up soon. I had a discussion with the psychiatrist, and these were some of the things that concerned me. So I said to the psychiatrist, I said, so what happens after treatment? Like, what did you, have you followed up with any of the clients? Have you seen what the long-term results are? And she said, no, we haven't done anything like that, but we really should do something like that, and looks at her partner. And then the director of the place was showing us around, and he said, this is the room where I'm thinking about doing the ketamine treatments. And she said, do you have a bigger room? So he took her into the conference room, and he's like, well, what about this room? And she's like, yeah, I could probably get 5 people in here, but what about a bigger room? So he takes her into the yoga studio, and he's like, well, what about this room? She's like, yes, we could easily do 20 people in here at a time. So I said to her, I was like, how does the group ketamine work? She said, well, we do a simple little intake on them, and then we administer the medicine, and we give them headphones and eye patches, and then they can just lay down and they go into their little thing for 40 minutes, 45 minutes, and then they go home. And I said, what about the integration?
Jessica, can I ask you a question? Did they mention, so if they had 20 people in the room, how many people in the room are monitoring them? Did she mention that, or did you ask that?
No. Well, so what I did ask was, I said, so how does that, who's monitoring them? And she said, well, we'll be monitoring them. She goes, but actually, I've never really led a group session before.
OMG.
And I just froze, and I was like, just shocked. Like, I didn't know how to respond to that.
Right. An experimental practice with experimental drug.
Exactly. That can cause a lot of harm. Psychosis, schizophrenia, death.
And there's no regulation on the milligram strength. I mean, some clinics say it's like a half milligram per kilogram of body weight, but there's no regulations where the clinics aren't doing like even 1 milligram, which could definitely really overdose someone on it.
Mm.
Absolutely. And then it went on to me to asking her, well, what's the integration process like? What happens after this? And she said, well, hopefully they're working with a therapist.
Set them free.
Hopefully.
Hopefully they're
Okay.
working with a therapist.
Right.
When are they scheduled to open, Jess?
They were scheduled to open at the 1st of May, but I haven't seen that they're open yet.
Mm.
Okay.
But there's good clinics out there. There are some good clinics out there.
Mm-hmm.
And that's what we want to talk with you about too. So when you're looking for these clinics, did I freeze?
No.
Okay.
Nope.
When you're looking for
I see
these
ya.
clinics, you want to be working with a psychotherapist who is also working with your medical provider. And they're doing thorough intakes on you, and they're doing blood work, and they're testing genetics. And Lori's going to talk to you about the genetics, because it's really important to consider some of these genes and how they might be detrimental to your care with ketamine or other treatments surrounding your depression.
Mm-hmm.
Okay, so let's like hone in a little bit on that with what you just said with genetics. So genetic testing, for any of our listeners who don't understand what it is, the majority of the genetic testing is done via saliva. And basically what you're doing is you're spitting into a tube where then you will then send it back to a name recognized DNA company. I personally like to use the DNA company out of Canada. And the reason I say name recognized is because if you're going to Amazon, people are stealing DNA data. So you have to be really careful. So I always recommend doing it under a certified or licensed healthcare provider, because they're usually working with companies that are tried and true. So anyway, you ship it off and you get it back, and it gives you, I don't know, probably 25 pages of different types of genes. And the genes are what you inherited from your mom and dad. You either are going to inherit one, you'll inherit two, and then there's the chance that you don't inherit either gene. So some of the genes that you'll see are genes that help you convert all of the toxins out of the body. And if there's a blockage, or you have what they call a genetic defect, meaning that you inherited two bad, and one good, or you didn't inherit any, and that makes a difference. Because if you genetically can't get rid of, let's say, a drug like ketamine, or we'll take it one step further, if you have a gene that is known as GAD, which really helps with your GABA, and GABA again is an amino acid. It is known as an inhibitory, meaning that it inhibits blood flow and it calms you and it puts you into parasympathetic, that means rest and digest, opposed to fear, fight, flight, spin, freeze, like a dopamine or an adrenaline. And when you have the wrong genetic makeup, I have one wrong GAD gene that I either inherited from my mom and dad, and they possibly inherited it from one of their parents. So on the GAD gene, what happens is my GABA, my neurotransmitter that calms my brain, is not working correctly. It's just a chemical defect that I have in my own brain. And there's really nothing that you can do about it, because you can't change your DNA. However, now that I know I have it, what I can do is do a pharmaceutical grade supplement. And I always say pharmaceutical because doing something like a brain MD or a Now brand or a Thorne or a Metagenics is way different than going down to your local Walgreens or your local Walmart and picking up something that you don't know if there's any additives. So for me, my amino acid, because I have a GAD gene that doesn't work correctly, my go-to is GABA. And I always look at GABA as nature's Valium. I love it. My brain needs it. It puts me back into parasympathetic. And again, these amino acids are tried and true for the brain. But if you have the wrong genetic makeup and you take something like ketamine, you may not be able to eliminate it from your body because it may you may see an uptick in your liver enzymes. You may not be able to get it out. They call it a half-life. That means if something lasts for 12 hours, maybe your genetic makeup is 6 hours. But knowing the genes, Jessica and Patty, they're really important, because if you don't have that, then you can't convert and you can't methylate, and it could put you in psychosis. And most of the ketamine clinics that I've talked to out there, none of them are doing that testing, and it's pretty inexpensive.
Yeah, they weren't doing it when any of them that I talked with either, but some of them were doing blood work, which that's good because they're testing the liver and they're testing the kidneys and things like that. But still, this is very important to understand your genetic makeup too. And that's another thing too. It does have an effect on the liver. It does have an effect on the kidneys, and it does have an effect on the bladder, and it does have an effect on the brain.
Mm-hmm.
So let's talk about how it's administered. It's administered through IVs, through injections, orally, as a sublingual or as a troche or troche. I call it a troche. That's how I was taught to say it, but some people call it a troche, TROCHE. Suppositories. And it comes in tablet form. It can also be snorted for those who abuse it. It's used to treat suicide, depression, PTSD, bipolar depression, OCD, anxiety, and substance addiction. And we have solutions, though, that are natural solutions that you can take that will actually repair your brain and repair the neurotransmitters in your brain. And working with any one of us, and we're all willing to do a 15-minute free consultation to talk with you about your treatment plan and what your healthcare needs are, to see if you would be a good fit for the amino acid therapy that we do, or even talk to you more about ketamine to help you make sure that that's a good decision if that's where you choose to go. And if you choose to go that route, really look to one of us to help with the integration afterwards, because we can also use the amino acid therapy and nutrition to help support your brain and being able to fire optimally and correctly and rebalance. And two, because neuroplasticity is real, that is one thing that science has shown over and over again, is that our brain is neuroplastic. It can rebuild, it can repair, it can create new firing patterns. So Lori, do you want to talk about how ketamine works on the brain?
So yeah, let's talk about it. But you know what? Let's take it just a little step further, just for a minute. So let's talk a little bit about root cause. Why are they going in for ketamine?
Bingo.
Because from everything that I've researched on the science and read, is ketamine may work when someone is more on the depressed side, but it may not work in an environment where somebody is more on the anxious side of it. So the thing that I just want to add, if somebody is considering, and I'm just going to put my cards on the table, I don't think that anyone from 11 to 18 should be doing ketamine. Maybe if somebody's been diagnosed with schizophrenia, they've been diagnosed with bipolar, and they have went through multiple, and when I say multiple, because I don't like to play Russian roulette with the brain, if they've tried a couple of really well-known big pharma meds, some that have been around for a very long time, and they are working under a good psychiatrist. I think sometimes in an adult world, again, never an 11 to 18-year-old world, that if somebody's really has been diagnosed with schizophrenia, bipolar, and they are really working with a well-known, a really good psychiatrist, and not one that's doing profits over people, one that's not going to be doing Russian roulette, maybe then it would be a time that they could try it with amino acids. But I don't think that any of these clinics, and correct me if I'm wrong, I mean, I've interviewed quite a few, and I know, Jess, you have too, I don't think they talk about root cause. Like if somebody was anxious or somebody is depressed, are they talking about foods that help? Are they talking about elimination diets first, eliminating things that could be disruptive to the blood-brain barrier and that gut-brain connection? I mean, we all know what wheat does. Wheat can definitely cause a disruption in the brain because there's a wheat protein called protein that could attach to the opiate receptor. And for the younger kids out there, 11 to 18, are they talking about, listen, are your kids, are your young teens, are they eating foods that contain red dyes and yellow dyes, things that are stimulating the brain, MSG in the foods? I don't know of any that are doing it.
No.
So I wanted to put that out there, that if you're a parent, you need to talk about root cause, because ketamine is not going to be a magic pill. And Patty, before I go on, I don't know, do you want to just talk about the doctor in Salt Lake City and what happened, just so that the listeners can, so that they can hear that?
Yes. I actually just pulled up the article on my phone. There was a doctor in, I believe it was 2 years ago, Dr. Parth Gandhi. He was 49 years old. He was a neuropsychologist and a psychedelic therapist practicing in Salt Lake City, and was found dead alongside his 16-year-old son. So he was running a ketamine clinic here, and using ketamine. And that's not uncommon. I actually worked with a doctor at a clinic here, a whole different clinic that wasn't a ketamine clinic, who was coming in to be treated for his own ketamine addiction. And yeah, he ended up shooting his son and himself. And it was a shock to the whole community. But it is it can be a very addictive drug. And obviously he went psychotic to do something like that. So that, that's the sad part of it.
That's the dangers. Hey, Leighton, can you put on the Andrew Huberman, just the video? Thank you.
Ketamine produces particular patterns of brain activity and this sense of dissociation when it's taken at sub-anesthetic doses. If you recall the clinical studies we talked about earlier, they injected 0.5 milligram per kilogram of body weight in order to provide depression relief for those patients. When people take ketamine, they will take it by different routes of delivery. And now here we have to expand our conversation to include both the clinical context, research studies, and recreational use. Now, I do that because typically when people take ketamine in a study, in a clinical study, they will get an intravenous into the vein or an intramuscular into the muscle injection of 0.5 milligram per kilogram of body weight ketamine. However, when people are taking ketamine recreationally, or when they are accessing ketamine legally by prescription and taking it at home, which is becoming a more common practice, they will often take it orally in pill form, or they will take it sublingually by putting it under the tongue or in their cheek, and then that so-called troche dissolves and the ketamine goes into their system. Now, an important thing to understand is that when people take ketamine orally, only 25% of the active form of ketamine makes it into the bloodstream. And when they take it sublingually, typically only about 35% of the total amount of ketamine they take is converted into metabolically active ketamine that acts on the neurons in their brain. So when you hear about the dosages used in studies, they are going to generally involve injections of ketamine and far lower doses of ketamine than when you hear about people taking ketamine orally or sublingually. So for instance, I weigh 220 pounds, that's 100 kilograms. So if I were to be in one of these studies, which I have not been, but if I were, I would be given 50 milligrams of ketamine by way of injection. However, if I were going to try to achieve the same amount of active ketamine in my bloodstream and brain as I would through injection, I would need to ingest 3 times as much ketamine by way of pill, and perhaps a little bit more by way of sublingual ketamine if I wanted to get the same effects. So if I were to take 50 milligrams by way of injection in a study, and I went to a different study and they said, okay, we want to recreate that effect, we're going to give you a pill. Typically, they're going to give me 150 milligrams of ketamine in a pill form, or 200 milligrams of ketamine in the troche sublingual form. Now, it's really important to understand this dose dependence according to delivery business, because I realize that nowadays, especially, a lot of people are taking ketamine through legal sources. So they're accessing it legally, but they're taking it outside the clinic, and more typically, they're taking it not by way of injection, meaning they're taking higher dose ketamine and they're taking it sublingually or orally. So it's very important to understand this dose dependence according to mode of delivery business. Now, in anticipation of this episode, I put out a request for questions about ketamine on Twitter, and I got many, many questions, some excellent ones therein. But one of the more common questions was, what is a K-hole in scientific terms? A K-hole is what's used to describe the subjective experience of when somebody takes ketamine, typically recreationally, and they end up in basically a pseudo-anesthetized state. What that means is that they took a dosage that for them put them beyond the boundary of the sub-anesthetic dose and has them transitioning into the anesthesia level dose of ketamine. Now, I mentioned everything I did about dosages before because it's very important to know that different people, even if they are of equivalent body weight, are going to respond to ketamine differently depending on how quickly and how thoroughly they metabolize ketamine. So in the clinical context, injections of ketamine into the vein or into the muscle are done at this 0.5 milligram per kilogram dose. And they have clinicians there, they have researchers there who are paying attention to whether or not the person is in a dissociative state, if they're still conscious, and to see whether or not the person is going into full-blown anesthesia. Now, that's one of the values of doing ketamine in the context of a legal clinical setting. However, I'd be remiss if I didn't acknowledge that a lot of people are getting ketamine legally, but then taking it at home, hopefully not alone. Hopefully there's someone there to monitor them, or they're in session with their physician over Zoom. That's actually happening more and more these days through telehealth. But that itself also has certain risks, right? Because if the person needs something and they don't have someone there immediately in the room to take care of it, that could be a very problematic situation. And of course, there are situations where people are taking ketamine recreationally. Regardless of how they're acquiring it, they're taking it and they are guessing how they are going to respond to it based on some crude understanding of dosages. But when people talk about a K-hole, what they're talking about is taking ketamine at a dose that for them takes them beyond the mild or perhaps even an extreme dissociation and starts placing them into full-blown anesthesia. And that itself actually can be dangerous. Going into anesthesia like planes of consciousness, while not always deadly, can be deadly. And it certainly can be and has been deadly when people start to combine it with other drugs, in particular drugs like barbiturates or alcohol. So I want to be very clear that the dosage ranges that you hear about when hearing about ketamine are extremely broad. And so is the variability to any one given dose. And so too is the response to a given dose in a given person, depending on the route of delivery. You need to be very careful about the ability of ketamine to take you into deep, deep planes of unconsciousness, and in some cases, death. And of course, as with any sedative, one needs to be extremely cautious about doing.
Can you hear us?
Yes.
Can you? Okay.
Yeah.
So, just to kind of recap that, I mean, you heard the word danger how many times? You heard the different types of milligram doses via IV, via pill. Recreational, I think, is a big issue right now with ketamine. And even when he talks about like telemed, think about it. You're going to have somebody at their home self-administer ketamine, and you have a doctor or a nurse practitioner or somebody who's just working in the ketamine arena telling yourself how to do it. You're home alone. How in the hell are you getting yourself out of it if
Yeah.
you're having a bad trip? Because I personally know someone who has had a bad trip on that stuff. And the end result could be devastating. So again, there's lots of different ways, telemed, meeting in person, but we go back to root cause. What's really ailing them? If you have anxiety, and I don't even like that word anxiety, but I'm going to use it in this case. What is the root cause of anxiety? Could it just be something simple like what you're eating or a food sensitivity? Could it be that you're living in a moldy home? Could it be that you're environmentally toxic that's going to lead to an uptick in anxiety and depression? So let's talk about how does ketamine work? So when you look at ketamine, there is a receptor. So even the amino acids, Patty, which we all know we love amino acids. Amino acids are you have to get it from your diet. Your body doesn't make it. And if you're not feeding your brain, then your brain is deficient in amino acids. We go back to GABA, which is an inhibitory. It means it's calming you. We go to dopamine, which is more like what they call an excitatory, noradrenaline, adrenaline. And then we talk about, I love 5-HTP, which in the big pharma world is serotonin reuptake inhibitors or SSRIs, which basically is calming. Again, what's the root cause of what's going on? They're not asking that. 2, it's dangerous. 3, we know that it's crossing the blood-brain barrier. So how does ketamine work? It attaches to a receptor in your brain known as NMDA, and it's N-methyl-D aspartate. And basically, it needs, let me back up a second. Basically, what happens is it attaches to a receptor for glutamate. Glutamate, again, is an amino acid that we have in our brain. It's an excitatory. And so it's attaching to the receptor of a glutamate excitatory, and basically a lock and key mechanism where it's passing through the blood-brain barrier because the door is opening it. And GABA is a neurotransmitter, also in your brain.
Okay.
But it's an amino acid. So when you're deficient in GABA, the actual neurotransmitter, then what you're doing is you're substituting it with a dietary supplement of GABA. So as the ketamine passes through the blood-brain barrier, attaching to the opioid receptors, attaching to the receptor, what it's doing, it's inhibiting the calming neurotransmitter called GABA. And when it inhibits the GABA, it excites the brain and releases larger amounts of dopamine. And what is dopamine? It's joy, it's pleasure, it's the ability to stay focused. Again, you still have to go back to root cause, like what is causing the lack of focus? And again, going back to the lack of focus, Leighton, can you put that slide up for the listeners that are watching? So I think it's important to talk about the glutamate-glutamine cycle. Again, 2 amino acids. And basically what happens again is genetics plays a huge role in the conversion of the glutamate and glutamine cycle. 2 amino acids, and they convert to GABA. GABA is a calming neurotransmitter that we have in the brain. But if it gets stuck in the pathway, when glutamate goes to convert to glutamine, which is an excitatory, also you find glutamine in a lot of the amino acid type of supplements. You'll find them in leaky gut type of supplement powders, because glutamine plays a role also in healing leaky gut. So you have to watch the milligram strengths if you are taking amino acid powders, if you are taking things for leaky gut, if you're consuming foods that have glutamine. But what happens is this cycle that goes from glutamate to glutamine to GABA, if it gets stuck, it can excite the brain and send someone into a panic attack, an anxiety attack. And so those questions really, when you're working with people as far as root cause, you really have to know that. I am a firm believer that before someone wants to do any type of a big pharma drug, I really believe that they need to do a genetic testing. Why? Because if they can't convert big pharma medicines, if they have a brain type that maybe is too high, maybe in serotonin, 5-HTP, which is the precursor to that, maybe it's something in a blood test, Jess, you talked about that, where they don't have the cofactors like B6 and magnesium and zinc. It could be something as simple and as easy as that.
Yep.
Instead of taking a synthetic drug that can excite your brain, that could lead to suicidal ideations, that person goes home, and yes, they're supposed to have somebody that's supposed to drive them home, but if they don't have anyone helping them, psychotherapist, a health coach like you and Patty on the other end, what happens then?
Yeah.
Because that drug could last up to 24 hours, even though they say that the half-life of that is 12 hours. But I have heard from the ketamine clinics that there are times people can't even go to work the next day. Why? Because you're putting a drug crossing the blood-brain barrier. Yeah.
The tranquilizer.
Yeah.
Right. Exactly.
Right. And with what you were saying too, it's important to note that that can cause seizures.
Right. The seizures.
The excitatory, getting too much of that excitatory going on, then it can lead to seizures. And especially if you have that GAD gene.
And that's why they have things like naloxone always on site. Because if for some reason somebody's having a bad trip, then they can go ahead and poke them with the naloxone, and it's going to block or counteract that opioid response that they're taking. And how do you know that a 0.5 milligram is right for everybody? I mean, who's dosing? If they're deficient or they don't have some of these genes, and let's just say they take an 11-year-old kid, because that's the minimum age that you have to be, that a parent can take a kid in, maybe having an anxiety attack, not getting to root cause, because we could go back to the red dyes and the yellow dyes. I mean, who's saying that kid, if they've got a defective genetic makeup that they can't do anything about, and let's just say they give them 0.25 milligram, like, who's doing it? There's not an MD, there's not a nurse practitioner on site, because they're teaching the people who run the clinic to give them the IV ketamine.
Yeah.
Right. Yeah. And one of the clinics that I talked to, it was just a psychotherapist administering the medicine. So,
Right.
I mean, and that's great to have a psychotherapist who's trained in this and highly trained in it, but still, that's very scary.
Do we want
It
to
is.
call it medicine, or do we want to call it a drug?
So
Drug.
Right. And what did we talk about earlier with what medicine does? Medicine is supposed to make you better and help you get better.
Right. And this is where I think people are getting tripped up with the medicines. Plant medicine, it's medicine, it's medicine,
Right.
it's medicine.
Right. It is. And, I think nowadays in life, with everything that is going on in the world,
Yeah.
I mean, the bullying, the whole transgender, all of that, the wrong foods in the diet, I really honestly think that kids learn like helplessness, like they feel that they're a victim and they don't know how to get out of that victim mentality. But then it goes back to a deficiency. What are you feeding the brain? And the amino acids, which, if you're not feeding your brain, the solution is going to go back to amino acids.
Well, this is the depleted neurotransmitters. That's one of the main root problems we're seeing. Depleted neurotransmitters. So when your neurotransmitters are depleted, you don't have self-confidence. You are a victim. There's a lot of things you can't see yourself moving forward because biologically in your brain you can't get out of it. And why are they depleted? From the food, the stress, from the drugs, from the
from the trauma.
Oh, and my gosh, almost every teenager I know has a cell phone. How about those kids that take the cell phones to bed with them? They leave them by their brain. I mean, it's literally like sitting in front of a microwave, and then they hear the little dings, and then all of a sudden they get up, they read something bad like, hey, did you hear that, Susie got asked to prom with somebody else, and then their whole world is turned upside down at 2 a.m. But Patty, why don't you take the lead in the solution, the power of amino acids, something that you don't need a prescription for. And we won't talk about the milligram strains, but we'll talk about the names. And just to put it out there, Jessica Endicott and Patty Reese are giving 15-minute free consults where they will do an amino acid therapy test with you to see where you are deficient. And they will literally, you can hire them and they will walk you through an entire program and an entire process without big pharma, without injections in your life that could be life-changing for you. But Patty, go ahead and let's talk about the power of amino acids.
Oh my goodness, the power of amino acids. Well, I know not everybody's is visual right now, but I'm just going to hold up a couple of these aminos. This is called theanine serine. Here's another one called True Calm. So there are definitely other better ways to handle what you need to calm down about.
And Patty, can you put the Now brand there's another Now brand. So I just want to throw this out. So Now is probably there's not a lot of family owned dietary supplement companies in the US now. Now is still a family owned business. And I like it because when you look at it, their ingredients are organic, non-GMO in a family owned business. So you held that up there, and Now brand you can get it even like at Whole Foods, Natural Grocers, any of those. And it's a great quality. Where you won't find it is Walgreens and Walmart, which is why we never want you going to Walgreens or Walmart to buy your amino acids. Sorry, Patty, I just wanted to put that out there.
No, the Now brand is a great brand. It's you're right. It is a family-owned business, and Tim Cuss, who knows them directly, he's a nutritionist out of Denver. He has his own company, said they are one of the best companies, and it's affordable. So that's really great. Amino acids rebuild our neurotransmitters. They also come from protein, but taking an amino acid can boost up your GABA neurotransmitter, which is what people are going to ketamine for. It can boost up tryptophan.
It's like nature's Valium. I love GABA.
Oh, I love GABA. Yeah, I love GABA too. And theanine is another one for the GABA neurotransmitter. There are some definitely isolated aminos that can help boost up in higher amounts that, we do amino acid charts to look at. But the aminos feed the neurotransmitters, where many of the drugs, and I'm going to call ketamine a drug, or the benzos, Ativan, Xanax, alcohol, those are just Band-Aids. And as we know in the addiction field, they help people initially feel better, because that's what it does. It boosts your GABA, it boosts your serotonin. So you go, oh, I can handle that. And then it down regulates and you need more. Boost it up again with what you're taking, alcohol, Xanax, ketamine, and then it drops it down again. It's not repairing the neurotransmitters. We need amino acids to repair our neurotransmitters and help us feel naturally high. We're supposed to have enough of that. We're supposed to be happy and deal with stress naturally.
I like that. And cofactors matter too. Cofactors like
absolutely.
B6 and magnesium and zinc,
Absolutely.
vitamin D, if you're deficient in those, that could definitely play a huge role in somebody having anxious thoughts or sad thoughts. And it goes back to the root cause that we know that these clinics aren't asking those questions. They're not getting to root cause. They're not testing. And you're playing Russian roulette with your brain, where amino acid therapy chart that Jessica and Patty do, it is free for you. So you can see where the deficiency may lie on why you could be having anxious thoughts or sad thoughts.
Yeah. I mean, anxiety is so treatable. So is depression. It's all treatable with nutrients and trauma work. I mean, it's not just one. You have to bring in the whole picture. Mindfulness, as Jessica talks about a lot. Her and I both talk about that.
Well, EMDR is incredible.
Absolutely.
Helping the neurotransmitter and the firing patterns, and helping to deal with traumas and somatic release too. And I want to just also say that our body has internal wisdom, and it knows what to do to heal when we give it what it needs to heal.
Bingo.
We're the ones who want to numb it, who want to block it out, who want to not feel uncomfortable. But if we can sit with that discomfort and we can listen to what our body is saying, and we can follow these symptoms, we can get to the root cause, which is what Lori was talking about. And so the symptoms are our body's way of communicating with us that something is going on. It's not for us to mute them. It's for us to listen and to understand and to follow that path and to then nurture and nourish our body. And because it's telling us, it's saying, help me, help me, help me.
And just, and also
what you said about the mute, though. We're not supposed to mute it. We're supposed to feel it and give it what it's asking for. And this is where people don't know. Like, a lot of people aren't educated in nutrition. So people don't know. And
I love that, Patty.
They're running to this doctor, then they're running to that drug. And meanwhile, okay, so learn more, read more, talk to someone that knows about nutrition.
And meditation and yoga, Jessica, which is what you're certified in. I mean, that could be done via telemed.
Yes.
I mean, the power of meditation and prayer is real. Learning how to reset into the parasympathetic, your rest and digest. And I just want to kind of put one out there for GABA. So I have a bad GAD gene, and I have a fear of heights. So when I ski and I'm looking at the bottom of the mountain thinking, oh my gosh, there is no way in heck I'm getting down. And if I ski without a GABA, then what happens is I have a horrible ski day, because to me, GABA is nature's Valium in a dietary supplement. And even my husband right now just carries GABA with him, because when I take the GABA, it calms the blood flow in my brain that keeps me looking at the fear of the height of the mountain. And then I take it, I freeform it. Freeforming is when you're removing it out of the capsule.
Yeah,
and
explain that,
placing
please.
it. Yeah, you're placing it under your tongue and you're trying to hold it 20 or 30 seconds. Why? The biggest thing for me is that I don't like swallowing all the gel capsules, you know, multivitamins, but it gets into your bloodstream quicker and it takes 20 minutes. So when you're working with somebody who's certified in amino acids like Jessica and Patty, and you're working via a telemed appointment with them, you can actually trial with them on the phone. And within 20 minutes, you're going to know if it's the right dose, or maybe you need a little bit more, maybe you need a fingertip more. But that's the power of amino acids. And I love GABA. So I have to start my day off with it.
Yeah. It's
So,
it's a great one.
The solutions.
right.
Really
And
good.
so we're going to put out the phone number to call in is 385-899-2134. I see that we do have callers. You can also email in your question if you don't want to talk. I get that. At info@TheWellnessCrusaders.com. You can either email in your question, you can call in your question, but for those of you that are going to listen to the recording afterwards, Jessica and Patty are giving people a free 15-minute health coaching session, which will include the amino acid therapy chart.
Right. An overview.
So if there is anyone out there considering ketamine, you have to ask yourself, is that ketamine clinic going to get to the root cause? I'm going to tell you no. I haven't interviewed, I haven't seen one. You know, they're going to ask you some simple questions like Jessica stated earlier on, but that's exactly it. It's simple questions.
Right. Yeah. And so things to consider if you're looking for a ketamine clinic, right? You want to look for the testing. You want to make sure that they have a medical provider that is working with a psychotherapist who is trained to help you with the integration process as well, and do the somatic work and really get into that internal voice. And then you also want to make sure that they understand the dangers and the risks and that they're communicating that with you, that they have done a thorough intake with you. They're looking at your liver. They're also looking at your kidneys and the function of them and how well you're able to detoxify and get rid of some of these toxins, because ketamine is a toxin and it is going to go through your liver. And if your liver is overburdened and over toxic, then you're not going to be getting that out of your system. You're not going to be metabolizing it as quickly.
And you know what? Another thing that we need to mention, and I know we have an email in question here, Patty. I don't know if you want to answer that one or not. It's in the chat line.
Okay.
You know,
Jessica,
another thing is that they have to think about, and I don't know how detailed these clinics. When you have an alcoholic that's going in for ketamine, if you have somebody that's on other drugs, the reaction that ketamine could cause, and if they're doing it IV, and if it is somebody that's drinking, you know that their liver enzymes are all jacked up because it's hard to excrete all of the alcohol that somebody, you know, is drinking. And that could also send them into psychosis. And another thing is there is no way for one ketamine clinic to know if they're abusing other ketamine clinics, because there are ketamine clinic hoppers. Why? Because they're addicted to ketamine. It is addicting. Patty, you talked about that doctor in Salt Lake City who was abusing it. So those are other questions that you have to ask yourself. So why not do the power of amino acids? No side effects.
amino acids and food.
Yes. So the question is, Patty, if you want to answer this question, is What foods can someone eat that that would contain amino acids?
So, right. And Jess can answer this too. Any of us can. It's protein foods. So we're talking about chicken, turkey, fish, beans and rice for some people if they're vegetarian, hemp seeds, walnuts, tempeh. People do okay with tempeh. I made a tempeh dish last night, and it's got a lot of protein in it.
Wow.
Anything else you want to add? Eggs?
What about the grams? How much, just generally speaking, how much should like an average, let's just say for the sake of this conversation, 150-pound person, like should they have, I don't know, 5 grams of protein, 25?
Half their body weight.
Okay.
So if it's a 150-pound person, it's 75 grams of protein per day. And that can be a little bit higher. And I know you want to add to that too, Jess. If somebody's working out, they have a very physical job. If they're in recovery, the brain needs more when it's recovering from either surgery, a bone break like I have, or in recovery from alcohol. I mean, most people are malnourished, so they need a little bit more.
Right.
Anything you wanted to add to that, Jess?
Well, and eating it every 3 to 4 hours.
Yeah.
I just want to make reference, and Patty, I know that you were taking this, is the power of D-phenylalanine, which is another amino acid, DPA. You broke your foot. You didn't have to be on any pain pills.
I was on pain pills for the first day in the hospital.
Right.
Because it was excruciatingly painful. And I didn't have any aminos with me at the hospital. I got off of them the first day, and then I went to Total Aminos, which is this here, Total Aminos, and then D-phenylalanine, which is DPA. This is also called Endorphagen by this particular company, which is an incredible, amazing painkiller, natural painkiller amino acid. And then I was taking tryptophan at night to sleep. And I was taking a blend of a GABA blend too to calm, because remember, the GABA works on the tightness in the muscles. So they wanted to give me a muscle relaxer. And I said, no, thank you.
Right.
I have an amino acid muscle relaxer.
I love it.
And the endorphins, the endorphins, the D-phenylalanine that you were taking, DPA, I just had oral surgery and I was taking that, and I didn't have to take any pain meds either. So it's incredible.
Yeah. Yeah, there is another way. And boy, what a better way if we can teach more people about this and coach more people about this. Yay.
Well, I think that now that the both of you are offering the 15-minute consult with the amino acid therapy chart, I think it's a really good way to get it out there.
Yeah.
And 11-year-olds can take amino acids. My little 9-year-old granddaughter, she's a GABA brain. I'm a GABA brain.
Mm-hmm.
So there's so much power in healing and repairing in amino acids.
There's another question. You want to take that, Jess?
So when free-forming amino acids, does your stomach acid lessen the effect? Yes, because the absorption is starting in your mouth. And so it doesn't have to go down into your stomach to break down. And so we're bypassing that. We're bypassing it. We're getting it into the bloodstream a lot more quickly. It's going into the blood-brain barrier within 20 minutes. Whereas if it's going into your stomach acid has to break it apart, break it down, and then absorb it, and then grab it and send it to your brain.
Yeah.
Right.
And they don't taste too bad. I don't think they taste too bad.
I like the Brain MD, the serotonin mood support by Dr. Amen. It's another calming amino acid. So for people that are on SSRIs, they could do a 5-HTP because you can't really take serotonin per se. You can take an SSRI, but that's not giving your body the ability to create more serotonin. What's happening
Right.
when they take a SSRI, it's blocking it. It's keeping into it's like a little synapse. It's like a bucket. And they think because they can hold it there, that the serotonin will help to increase your calmness, but it's actually not giving you more serotonin. So by taking a 5-HTP or a tryptophan, something that's a precursor to it, making sure your cofactors like B6, a lot of times you'll find B6 in some of these amino acids, but anybody struggling out there with any type of an emotional issue, anybody considering
Any mental health issue.
ketamine, yes, we ask that you send us an email, and Jessica and Patty both, and myself, we are there for you.
Yeah.
You need a support group because honestly, you're never alone. We're here for you, even if you don't have family members. So we've got a lot of people that we know that will just want that extra support. So never feel that you're alone out there. I don't know what you want to do to, how do we want to wrap it up?
Well,
How
yeah,
do people get a hold of you both?
Patty and I also have our Love Your Brain course that's coming up too. We haven't set an official launch date, but if you send us your email, you shoot us an email, info@TheWellnessCrusaders.com. We can add you to that list. And that's going to go through the nutrition and the amino acid support. And also you get coaching with it too.
Yeah.
So
We're going to be doing group coaching and really be supportive for your journey.
How long is that class?
8 to 12 weeks.
Okay, awesome.
Mm-hmm.
And then how can they find more, out more about that?
Yeah. So sending us an email at info@TheWellnessCrusaders.com.
That's the best way.
Okay, website?
CollectiveHealingArts.life.
Patty?
PattyReese.com
Okay. WellnessCrusaders.com.
and WellnessCrusaders.com. Yeah.
Facebook?
Facebook, any of our Facebooks, the Wellness Crusaders Facebooks, or our individual personal ones too.
Yep. Just reach out.
Instagram too. Yep.
And this is recorded. It'll be posted on next week on kmmu.org, which is also known as Main Street Media Utah.org. But go ahead and we'll close out.
Yep. Thank you, everyone.
Thank you, everyone.
Much love.
Thank you,
Much love.
everyone.
See you again.
All right. Bye, ladies.
Bye, Jess. Bye, Lori.
Bye.
Love you both.